Assalamualaikum students, today we will study the joints of the lower limb, in which we will cover the tibiofibular joints and the ankle joint. So there are two tibiofibular joints, the proximal tibiofibular joint, also known as the superior tibiofibular joint, and the distal or the inferior tibiofibular joint. Now the superior or the proximal tibiofibular joint is a plain type of synovial joint formed between the flat facet which is present on the fibular head and a similar articular facet which is located posterolateral on the lateral tibial condyle. Now a tight tense capsule, a joint capsule, it surrounds the joint and attaches to the margins of the articular surfaces of the fibula and tibia. Now this capsule of this superior tibiofibular joint is strengthened by the two ligaments, which are the anterior and posterior ligaments of the head of the fibula. This is the head of the fibula, this is the tibia. So between them there is the anterior ligament of the head of the fibula, and this is the posterior ligament of the head of the fibula. Now the joint is crossed posteriorly by tendon of the popliteus, and the movements which are possible at this joint, slight movement of the joint occurs during the dorsiflexion of the foot, and this superior or the proximal tibiofibular joint is basically supplied by the branches from inferior lateral genicular and anterior tibial recurrent arteries, whereas the innervation comes from the common fibular nerve and the nerve to the popliteus. Now we will talk about the tibiofibular syndesmosis, which is basically a compound fibrous joint. It is a fibrous union of the tibia and fibula by the help of this introitious membrane, which is uniting the shaft of the tibia and fibula and the anterior introitious, posterior tibiofibular ligaments and the anterior tibiofibular ligaments. This is the anterior tibiofibular ligament, this is the posterior tibiofibular ligament, and this is the introitious tibiofibular ligament, which is taking part in the formation of the distal tibiofibular joint. Now the integrity of the inferior tibiofibular joint is essential for the stability of the ankle joint, because it keeps the lateral malleolus firmly against the lateral surface of the talus. Now if we talk about the articulating surfaces of the distal tibiofibular joint, we know that the rough triangular articular area present on the lower half of this or lower end of the fibula, it articulates with a facet on the inferior end of the tibia, and the introitious tibiofibular ligament, here it is in this introitious tibiofibular ligament is continuous above with this introitious membrane, and forms the principal connection between the tibia and fibula. Now this distal tibiofibular joint is strengthened by the two ligaments, that anteriorly and posteriorly, which are known as the anterior and posterior tibiofibular ligaments, and the distal deep continuation of the posterior tibiofibular ligament is the inferior transverse ligament, which is basically will be forming the important, this one as you can see in this picture, inferior transverse ligament, which is a continuation of the posterior tibiofibular ligament, and this will be playing an important role in giving the stability to the articulating surfaces in case of the ankle joint. Now slight movement of joint occurs in this distal tibiofibular joint, and this distal tibiofibular joint is supplied by arteries from the perforating branches of the fibular artery and from the medial malleolar branches of the anterior and posterior tibial arteries, whereas innervation to this joint or syndesmosis arises from the deep fibular, tibial and the saphenous nerves. Assalamualaikum class, today we will discuss the ankle joint, which is basically a compound complex hinge variety of joint. Now the articulation of the ankle joint is such that the upper articular surface is formed by the lateral malleolus, the lower end of the tibia along with the medial malleolus, and all these three structures, that is the lateral malleolus, lower end of the tibia and the medial malleolus, they form a bracket shaped socket into which the lower articular surface, which is formed basically by the body of the talus having the articular facets on its lateral, superior and the medial surfaces, fits into this socket, and this socket is deepened by the presence of inferior transverse tibiofibular ligament, which is extending from the lateral malleolus to the posterior border of the lower end of the tibia. Now the ankle joint, also known as the pterocrural joint, it is a synovial joint of modified hinge variety, and in case as in the case of all the synovial joints, this ankle joint, the articulating surfaces, they are covered with the hyaline cartilage. The movements which are possible at this joint, these are the dorsiflexion and plantar flexion, and depending on these movements, the axis of rotation is not fixed, but it changes between the extremes of the movement, that is the plantar flexion and the dorsiflexion. Now, in case of the ankle joint, the weight-bearing surfaces are the upper trochlear facet of the talus and the inferior facet of the tibia, whereas the stabilizing surfaces of the ankle joint, they are provided by the medial and lateral malleoli. Now, the joint is enclosed in a capsule, which is then lined by the synovial membrane, and now this capsule is attached to the articular margins of all the three bones taking part, and that is the talus, the fibula and the tibia, except the anterior part of the talus where it is fixed some distance away in front of the neck. The synovial membrane is attached to the articular margins of the talus and clothes the intracapsular part of the neck, and then elsewhere it is attached to all the articular margins and lines the inside of the capsule. It is strengthened by the strong medial and lateral ligaments, which basically not only give strength to the joint but also helps in the movement performed by the ankle joint. Now, this ankle joint is reinforced on the medial side by a strong and large deltoid ligament, also known as the medial ligament of the ankle joint. Now, it is attached by two parts, deep part and superficial part. Proximally, it is attached to the medial malleolus and of the tibia. The medial ligament then fan out from the malleolus and it is attached distally to the three bones, that is the talus, the calcaneum and the navicular, via four adjacent and continuous parts. For example, the part of the deltoid ligament attaching to the navicular is known as the tibionavicular ligament. This is the tibionavicular part of the deltoid ligament extending from the malleolus to the navicular bone, and the part of the ligament which is attached to the calcaneum is known as the tibiocalcaneal ligament. This one from the tibia to the calcaneum, and the part which is attaching to the talus is in the two parts, that is anterior and posterior tibiotalar parts. These tibiotalar parts are the part of the this one, anterior tibiotalar ligament and the posterior tibiotalar ligament. These are the part of the deltoid ligament extending from the tibia to the talus bone. So this medial ligament stabilizes the ankle joint during eversion and prevents the partial dislocation of the joint. Then on the lateral side, the ankle joint is reinforced by the lateral ligament, and these are basically three separate bands radiating from the lateral malleolus, and these are anterior talofibular ligament, the posterior talofibular ligament and the calcaneofibular ligament. The anterior talofibular ligament, this one here you can see, this joins the anterior border of the lateral malleolus to the neck of the talus, whereas the calcaneofibular ligament, this one, it extends from the tip of the lateral malleolus, and runs down and back to the lateral surface of the calcaneus. This is the calcaneofibular ligament. Then we have the posterior talofibular ligament. The posterior talofibular ligament, this one, lies horizontally between the malleolar fossa of the fibula and the lateral surface of the talus. So laterally, the ankle joint is reinforced by the anterior talofibular ligament, the posterior talofibular ligament and the calcaneofibular ligament. And in the upper part of the ankle joint, as we have already discussed, and there is a strong ligament which is the posterior tibiofibular ligament, the lower part of which it also called as the inferior transverse ligament, which basically covers the upper articular surface and deepens the gap for the lower articular surface, that is the talus, and it is covered by the hyaline cartilage and articulates with the talus. And both these and the whole of the tibiofibular ligament and its lower part, that is the transverse ligament, they helps in the dorsiflexion and the plantar flexion. Now the stability of the joint is ensured by the close interlocking of the articular surface, as we have already discussed. That is the lower lower articular surface, that is talus, it is completely fitted into the socket formed by the upper articular surfaces. The strong collateral ligaments on the sides, the tendons that cross the joint, okay, these are the tendons which you have read in the region of the leg, that is all the flexors and extensors of the leg, they pass through the reticula and they enter which is attached in the region of the ankle joint. And there are 4 tendons in front and 5 behind, which is crossing the joint and giving stability to this ankle joint. So if just to revise interiorly, medial to lateral side, we have tendon of tibialis anterior, extensor hallucis longus, anterior tibial vessels, deep peroneal nerve, extensor digitorum longus and peroneus tertius. These all are the structures which is passing anteriorly behind the extensor retinaculum, okay. And posteriorly we have the medial to lateral. From medial to lateral we have tibialis posterior tendon, flexor digitorum longus, posterior tibial vessels, tibial nerve, flexor hallucis longus, peroneus brevis and peroneus longus. So all these tendons, they give strength and stability to the ankle joint. The blood supply of the capsule and ligaments is derived from the anterior and posterior tibial arteries. This one anterior tibial artery, and this is the posterior tibial artery, and arteries, and they also branches from the peroneal artery. The nerve supply, that is the innervation of the ankle joint, is by the deep peroneal and the tibial nerves. Now as far as the movements of the ankle joint are concerned, the movement which takes place at the ankle joint are the dorsiflexion and the plantar flexion, which occurs around a transverse axis passing through the talus. Now there is one point which has to be cleared at this stage, that the dorsiflexion and plantar flexion, these are the movement which occur at the ankle joint, whereas the inversion and inversion and eversion, they do not occur at the ankle joint, they occur at the tarsal joints. We will discuss later. So coming to the dorsiflexion and plantar flexion, dorsiflexion is performed by the muscles present in the anterior compartment of the leg, and in this condition the position of the foot is that in which the toes faces upwards and the dorsum is flexed, and about 10 degree of the dorsiflexion is produced by the tibialis anterior, assisted by the long toe extensors and peroneus tertius, and this dorsiflexion is limited by the passive resistance of the triceps suri muscle and also by the tension in the medial and lateral ligaments. Whereas the plantar flexion, in which the toes faces towards the ground, these are produced by the movement muscles present in the posterior compartment of the leg, and about 20 degree of this plantar flexion is produced by the gastrocnemius and soleus and assisted by the long flexor tendons and long and short peroneal muscles. Now what happens during dorsiflexion? Dorsiflexion is a strong, and during dorsiflexion the ankle joint is a stable joint, whereas during plantar flexion the ankle joint is not a stable joint. The reason behind this is that the because the talus, which basically forms the lower articular surface, it has a narrow posterior part and a wide anterior part, and what happens during dorsiflexion, that this wide anterior part of the talus, it fits closely within the lateral and socket formed by the lateral and medial malleolus, and this position basically tightens the lateral and medial ligaments, and it helps in the in positioning the foot, initial positioning of the foot, as in the thrusting movement like walking, running and jumping. So during dorsiflexion, because of the articulation, tight articulation of the surfaces, the joint is stable. But what happens during plantar flexion? The narrow posterior part of the talus, it is not fixed within the lateral malleoli. There is a space between, or you can say it is loosely fitted within the malleoli, and so this is an unstable condition, and also because of this unstable condition, the some degree of you can say inversion, eversion, adduction, abduction, they are possible at the ankle joint during plantar flexion. The ankle sprains are common at the ankle joint. There are two types of sprains, either of the lateral side or the medial side. The medial sprains are less common as compared to the lateral, and the medial sprains usually occur due to excessive eversion of the foot, and as a result of this there is a tear of the lateral, or you can say the medial or the deltoid ligament, this one. And as this deltoid ligament is attached to the medial malleolus, and by the pull of the medial ligament it can tear off the medial tip of the medial malleolus. The lateral ligaments, on the other hand, they are more common. You can say the lateral sprains, they are more common as compared to the medial sprains, and these lateral sprains usually occur caused by the excessive inversion of the foot along with the plantar flexion of the ankle. And the ligaments which are involved during this sprain of the lateral angle are the anterior talofibular ligament and the calcaneofibular ligament, and they are partially torn, giving rise to the great pain and local swelling. Now, sometimes there is dislocation at the ankle joint. What happens basically, we can call it a simple dislocation or a fracture dislocation. Now, which occur due to forced external rotation and over eversion of the foot. Okay, either there is external rotation or either there is over eversion of the foot. What happens during this movement? The talus, which is forming the lower articulating surface of the ankle joint, it is rotated externally, right? And by externally rotating the talus, it is pressed, or you can say pressed against the lateral malleolus of the fibula. And by this pressing to the lateral malleolus, it causes it to fracture spirally. If that external force continues, the talus moves laterally, and the medial ligament of the ankle, which is attached to the medial malleolus, it becomes taut and it pulls off the tip of the medial malleolus. And if the talus is forced to move still further, that is external stimulus or external force is continuing, then what happens that the rotatory movement results in the its contact with the posterior inferior margin of the tibia, which then tears off.